Hi, friends. This might be a little bit of a rant, so strap in. Listen, let me tell you something. I have spent my entire career trying to convince people that health literacy is different than readability levels. So we often have clients come back and say to us, we need to write on a 7th grade reading level, or we need to write on a 4th grade reading level. And my response to that is, what is a reading level? Where are you getting the research from? What is it based on? Health literacy is very different than reading levels. Health literacy is a form of competency. A patient has to be able to understand what's happening to them, what the healthcare practitioners around them call it, and they also have to be able to talk about what is going on with them. And they need to be able to respond when somebody asks them pointed questions about their health condition and their care. So when we're creating content for patients, we need to be aware that reading levels are not the only way to assess the competency that a patient has around the subject. And so using a software program to tell you that your content is acceptable is not going to help you determine if your patient truly understands what you're telling them. Now, the best way to assess health literacy competency is by using the talkback method. The best way is to say to the patient, do you understand what I'm saying? Unfortunately, we can't really do that in digital content, but there are things that we can do to increase a person's understanding and their readability, the content's readability. And that is basic web writing best practices. Bullets, lists, chunks, headings, making it clear what the person needs to understand if they click on the link. These are all very easy things that all of us can do to make sure that our health content is understandable. There is a tool that is better at helping you assess whether or not your healthcare content is appropriate for your audience, and it's called the Patient Education Material Assessment Tool. We'll have the link above or below, depending. And then you can also look at arc.gov's Health Literacy Toolkit will also include that tool. So again, reading levels might be in your style guide, but I would argue that that is a really great conversation to have with the people creating this content, with your patient education arm, with patient support services. Are reading levels really getting you to where you need to be? Because if you aren't sure that people are really understanding your content by a formula online, then you're not getting at what you really need to get at. So off my soapbox now, but if you ever want to talk about this, I'm more than happy to have an entire conversation around it. And if you're having trouble convincing the people in your organization that it's really important to expand your understanding of what makes content readable and understanding, let me know, because I will be more than happy to have a conversation with them about it too. See you next time.